My name is Rhee, and I'm the editor-in-chief of CJASN, and I had the pleasure of meeting today with Dr. Christine Limonte at the University of Washington, who is our 2024 CJASN Trainee of the Year for her outstanding study on associations of biomarkers of tubular injury and inflammation with biopsy features in type 1 diabetes. Dr. Limonte, can you please introduce yourself to the CJASN audience?
Happy to. My name's Christine Limonte, and I'm a nephrologist and clinical researcher at the University of Washington. And my research focus is in diabetic kidney disease. Specifically, I'm interested in the mechanisms that underlie the onset and progression of diabetic kidney disease, and in why some people with diabetes develop kidney disease while others don't.
Wonderful to hear. And what motivated your interest in this research area?
So, diabetic kidney disease has traditionally been viewed as a primary glomerular disease process, but there's evidence of tubulointerstitial injury and dysfunction in diabetes as well. And I've been interested in examining the mechanisms that underlie this tubular injury, inflammation, and dysfunction in type 1 diabetes, and how this relates to long-term kidney function decline. Over the last several years, a number of biomarkers of tubular injury, inflammation, and dysfunction have been identified that make it much more possible to explore this question.
It's quite fascinating. What specific research questions were you hoping to address with your study?
Our study aimed to identify associations of various biomarkers of tubular injury, inflammation, and dysfunction with kidney biopsy features in adults with type 1 diabetes and normal kidney function. Previous work in this cohort had identified histopathological abnormalities in the kidney in early type 1 diabetes, even in the complete absence of albuminuria and when eGFR was normal. And we wanted to see if tubular biomarkers measured in the blood and urine reflected these histopathological abnormalities.
Very interesting. And what were the main findings of your study? Also, what were the main strengths and limitations of your study?
Well, we found that two blood biomarkers, kidney injury molecule 1 and soluble tumor necrosis factor receptor 1, were associated with the most kidney biopsy features. Specifically, higher kidney injury molecule 1, which reflects proximal tubular injury, and soluble tumor necrosis factor receptor 1, which reflects inflammation, were associated with greater mesangial expansion, glomerular basement membrane width, interstitial fibrosis, and arteriolar hyalinosis. And overall, these findings suggest that tubular injury occurs early in diabetic kidney disease, even before changes in eGFR and albuminuria are seen. As far as strengths and limitations, strengths of our work include the use of a large type 1 diabetes kidney biopsy cohort with rigorously attained morphologic data. And some limitations are that there was no control group for comparison, and that the study population primarily consisted of white individuals, which limits the generalizability of our results to other racial and ethnic groups.
Thank you so much for sharing these important findings. And what are the next steps for your research? Following your study, what are the future directions the field should be heading?
Well, I have a number of ongoing projects that are continuing to examine the tubular interstitium in diabetic kidney disease. One project that directly expands upon this work is characterizing longitudinal trends of tubular biomarkers in early and late type 1 diabetic kidney disease, basically laying out the trajectory of tubular function decline in type 1 diabetes. I'm also working on a project that examines the role of a specific molecular process, autophagy, in proximal tubular cells in diabetic kidney disease. And I think that the future of diabetic kidney disease is really in the identification of histopathological and molecular subtypes. Identification of these diabetic kidney disease subtypes will allow for improved prognostication, diagnosis, and implementation of targeted therapies.
Thank you for sharing all of these exciting research directions. What words of advice or wisdom do you have for people who are interested in pursuing research training with a focus on kidney health?
Well, first of all, you can do it. Pursuing research means learning a new set of skills that can be learned with time and practice, just like any other skill. And having a mentor who you work well with and who is able to connect you with new opportunities is key. Lastly, I'd suggest that folks pursue research topics that they're passionate about. It really keeps the work exciting.
Thank you so much, Dr. Limonte, for sharing these wonderful words of wisdom and encouragement. I once again want to congratulate you for being our 2024 CJASN Trainee of the Year. Your work is inspiring. And I also want to thank our CJASN audience for dialing in to hear more about Dr. Limonte and her work. Thank you again.
Thank you, Dr. Rhee. Happy to be here.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.